Good afternoon, everyone, or good morning, depending on where you're joining us from. My name is Dan Jeline. I'm with the Pedestrian and Bicycle Information Center. I'm welcoming you to today's Pedestrian and Bicycle Information Center webinar. The topic today is arterial streets, and specifically pedestrian safety on arterials. It's a really important topic, I think one that whether you're a professional working in the field or an advocate or a health professional, someone really interested in pedestrian safety and protecting pedestrians, arterials are probably a type of street that you've heard of or are focused on improving or changing in your community. So we're going to spend time with our panelists today, really exploring arterials, what makes them so dangerous and so problematic for pedestrians, and how we might go about making improvements to improve community health and improve our safety. So we're glad that you're here to join us. I only have a few bits of information to share with you as an introduction before I really hand things over to our panel to focus on the topic at hand. You as attendees will not have the ability to speak during the webinar today, but you do have the ability to submit questions and comments to us along the way. So if you look for the questions pod in your GoToWebinar control panel, we encourage you to submit questions when you have them at any time. We may ask you for some input on some questions we have, and those are comments that I can read out to our panel when we have some discussion saved for the last bit of the webinar. So we do have about 20-25 minutes or so at the end just to field your questions, respond to those. So please send those in when you have them. We're going to be archiving the webinar today on our website, pedbikeinfo.org/webinars is where you can find that information. We've already posted a copy of the slides as a PDF, so you can follow along with us there. I'll share that link in a moment in the chat pod. We also are recording this webinar, so we'll be posting the recording there. So if you know someone who is interested in this topic or someone who couldn't make it, you'll be able to share that information with them after the webinar. We're providing a live transcript of this webinar today as well. So the link on the screen is one that I will share with you in the chat momentarily. If you need the live transcript, we'll provide that to you as part of this session. We are also going to provide a follow-up email later today that has information about how you can claim professional development hours, get a certificate of completion for the webinar. So that'll come to you about an hour after the webinar, instructions on how to generate those certificates, where to find your CM credits from AICP, which we've gotten them approved for 1.5 CMs. So we'll provide those too. That'll all be coming to you a bit later today. And as always, we hope that you'll review some of the recent sessions that we've held. We did a session last week on traffic signals and biking and walking, and we'll have some more exciting sessions coming up soon. Without much more delay, what I'd like to do is introduce the panelists who have joined us today. And I'll begin with Dan Goodman. Dan is the Mid-Atlantic Director of Planning at Tool Design and has nearly 20 years of experience in multimodal transportation planning and design in the public and private sectors. Dan has deep expertise working on a broad range of active transportation project types for public agencies and private stakeholders throughout the U.S. He led the pedestrian and bicycle program at the Federal Highway Administration from 2013 to 2018, spearheading new national pedestrian and bicycle planning and design resources, and receiving the Public Sector Professional of the Year Award from the Association of Pedestrian and Bicycle Professionals. So we're delighted to have Dan Goodman with us today. Thomas Hillman is also joining us. Thomas is a transportation planner at Tool Design Group. He's contributed to diverse research and applied projects for national, state, MPO, and local clients, including Vision Zero safety analysis and countermeasure selection, shared micromobility system planning and evaluation, and bicycle and pedestrian network planning and analysis. He's passionate about helping to envision and deliver safe and sustainable mobility options that result in an enhanced user experience and improved access for all community members. So thank you, Thomas, for joining us today. And we're also joined by Dr. Carrie McAndrews, who is an associate professor in the Department of Planning and Landscape Architecture at the University of Wisconsin-Madison. Her fields of research are transportation planning, policy, and design. And her research seeks to understand how emerging health, safety, and environmental goals become part of mainstream transportation decision-making. Equity is central to these goals, and her research analyzes the distribution of transportation's health impacts, as well as how people organize to influence transportation decision-making. So our panel is going to have a lot of great information to share with you today about arterials and pedestrian safety. So we're glad that you're here. We're glad that our panelists are here, and I will next turn things over to kick it off with Dan Goodman. Dan, please let me know if you see the alert that came across your screen, and I'll tell you when we've got your slides. If you swap that view, if you swap that view, Dan, I think we should be all set. Perfect, thank you.
Okay, great. Thank you, Dan. My name is Dan Goodman. I'm the Director of Planning for the Mid-Atlantic region at Tool Design. Um, so I'm going to begin by providing an introduction and overview about pedestrian safety on arterial streets. And then, as Dan mentioned, Carrie and Thomas are going to follow up with some more detailed information. We thought that we would start out the presentation today by talking about an arterial street in our daily life. And so while I describe Piney Branch Road, which is just down the street from my house, I want to encourage you to answer these 3 questions in the chat box. So name an arterial street that is part of your everyday life. Why do you spend time there? What is challenging and what could be done better? We encourage you to think about this, and while we're speaking, and enter this information into the chat box, and we would love to come back to it and talk about it as part of the discussion. So Piney Branch Road, for me, the dynamic that I want to describe is my kids crossing at the crosswalk with the pedestrian walk signal. This is them here on the right. There's 3 potential conflicts that happen every time we cross this intersection, which is 2, sometimes 4 different times a day. There's the car in the foreground that is turning right, conflicting with the pedestrian movement that has the pedestrian walk signal. There's the car coming down the hill from the right and turning right onto Philadelphia Avenue. And that's a potential conflict point. And the third one is the car coming towards us, turning left up the hill, up Piney Branch Road. So there's 3 potential conflicts with my kids when they're crossing this intersection with the pedestrian walk signal. I regularly have to hold up my hand and hope that the driver is not on their cell phone or shooting a small gap in traffic. This situation just exists year after year. And a theme of what we'll be talking about today is that this situation in many ways reflects choices and values that we're making, and values that we're acting on in our transportation system. What I want to emphasize, and I think what you'll hear in all the presentations today, is that we do know what to do to make conditions safer, and we can make different choices. So I'm going to provide an introduction and overview of pedestrian safety on arterials. Carrie is going to bring in issues of health and equity into the discussion of safety. And then Thomas is going to talk about systemic safety approaches and treatments. And then we'll do questions and answers and discussion after that. But why, if we can step back a little bit, why are we talking about this? Well, I would say that US pedestrian deaths have increased by 53% in the last decade. The risk of pedestrian fatality increases as traffic increases. The pandemic experience is offering a confounding take on this, in that it appears that traffic decreased at the same time that fatalities increased significantly. But arterials are especially challenging because they carry high traffic volumes, often at high speeds. From 2009 to 2018, the largest increase in pedestrian fatalities occurred on principal and minor arterial roads. And that's over a 70% increase in pedestrian deaths. So arterials are disproportionately dangerous for pedestrians. 13% of US roadway miles are non-interstate arterials, but in recent years, more than half of US pedestrian fatalities occurred on these roads. The chart that's highlighted on the slide now, it talks about characteristics relating to the highway functional classification system. And the chart highlights a problematic reality from a pedestrian standpoint. Commercial development, destinations, and transit are located along arterial streets. And this can create potentially dangerous interactions between vehicles and pedestrians. These streets are often designed for higher motor vehicle speeds and volumes, and they typically have more travel lanes, which create longer pedestrian crossing distances. So on these street types, the things that people need are located on the streets. At the same time, we have high volumes and high speeds. In many ways, the choices that we make, historically, the choices that we have made on arterial streets really reflect the classification of the street within the larger transportation system, and not the actual use of the street. And that's contributing to some of the problems that we are seeing. To say a little bit more about this, this is the conventional concept of the role of arterials. So we often think about arterials through kind of a throughput lens. The hierarchy of the functional system consists of principal arterials, minor arterials, collectors, and local roads and streets. We know that roads make up the functional system. They differ for urban and rural areas, but the fundamental point is that we often think of arterials in the sense that they function, they have a throughput function, but we often need to prioritize the access functionality a lot more, because obviously that's where, as I've said, the destinations, the jobs, the transit, and the schools are located in many communities. So research shows that arterial safety, it's an issue for pedestrians. A recent study by Bob Schneider, Rebecca Sanders, and Frank Pruhl showed it looked at 34 pedestrian fatality hotspot corridors in the US. And what it showed was almost all are multi-lane roadways. 70% require pedestrians to cross 5 or more lanes. Over 3/4 have speed limits of 30 miles per hour or higher. 62% of them had traffic volumes over 25,000 vehicles per day. Nearly all had commercial land uses on them, and 3/4 were bordered by low-income neighborhoods. So what I want to emphasize here is that the problem, in a lot of ways, we know what the problem is, and we know what to do about it. But in a lot of instances, we haven't been willing to do what needs to be done. And that is what Thomas is actually going to talk about in his presentation is the things that we know that work in this situation. I would argue that in a lot of ways, the reason that we haven't made these changes on these dangerous arterial streets is an unwillingness to have an honest discussion about priorities and about trade-offs. So what are the common unsafe conditions on arterial streets? We often see arterial streets that are missing sidewalks, that we don't have pedestrian signals or marked crossings. In a lot of cases, there are intersections where all 4 crosswalks are not marked. We've got bus stops without sidewalks or marked crossings. And in a lot of places, we have schools on these high-speed arterials. I think one issue that is often underappreciated in this safety story is the role of lighting. We know that a growing majority of fatal pedestrian crashes occur in dark conditions, which really underscores the need for better lighting. It speaks to a broader challenge of maintenance, which I think in a lot of ways is less flashy, but is incredibly important. So we've talked about unbalanced priorities and inadequate design. We also know that land use is clearly an issue. So we started here, which is what it used to look like in a lot of communities, which is more human scale, compact, mixed use development, slower speeds, and friction built into the system, which can end up making it safer for everyone. And what we ended up in is places that look more like this, where we've got overcapacity streets, we've got design that encourages higher speeds, longer crossing distances for pedestrians, which ends up increasing their exposure to potential crashes. And we've got a lot of potential conflict points, for example, at driveways. In a lot of ways, this is every community. Arterials play a really important role in shaping the environment that we live in. Commercial land uses cluster along arterial streets, and so as I mentioned, it's the stuff that people need access to and the places that they need to go for their jobs. So land use is key. It's a challenge that transportation agencies don't control land use, but I would argue that we don't just get to throw up our hands in this situation. We do have examples of people stepping into this space and finding solutions. In the DC region, the Metropolitan Washington Council of Governments, the MPO, has a transportation and land use connections program where year after year they're helping their jurisdictions find solutions in this space. In Montgomery County also, they are implementing Vision Zero ideas in their growth and infrastructure policy. There's discussion of non-auto mode share goals. They're reducing traffic congestion tests near transit and reducing transportation impact taxes in desired growth and investment areas. So I think they're really good examples of policy that try to acknowledge the connection between transportation and land use. Parking also obviously is a big picture linkage between these two issues. So design is an issue. We know what to do. In most cases, I think it requires tough choices. Land use is a challenge, but we're not powerless in this situation. And I want to end by also acknowledging the role of equity and racism and non-inclusive planning processes, because I think in combination, this can lead to unsafe conditions. You know, a situation where there's a greater reliance on walking and public transit for people with lower incomes, older people, younger people, and people with disabilities. There's also essential services located on arterials, which often lack pedestrian safety infrastructure. So there are things like grocery stores and daycares and bus stops and senior centers in places that are relatively the most dangerous in the transportation network. I think with regards to arterials, a lot of this comes down to assumptions of who we are planning for and who is engaged in the planning process. I think historically, mobility often referred to people in cars traveling through an area. It was primarily to and from work and often referring to people that lived somewhere else. An important part of a new approach is to fundamentally acknowledge that mobility also applies to people traveling by all modes and for all types of trips. Until we do that and acknowledge all the different types of mobility and all the different types of trips, I fear that we'll continue to see kind of disparate safety, health, and environmental outcomes. These situations that we see now and understand now, which is that Black and Indigenous people have higher pedestrian death rates, that lower income neighborhoods have higher pedestrian death rates, and that older pedestrians have higher death rates, just as to take a few examples. So at this point, I'd like to pass to Carrie McAndrews to talk in more detail about these issues, specifically the intersection of pedestrian safety, health, and equity. Carrie?
I'm here. Thank you, Dan. Well, that was a really excellent overview, Dan, with a lot of good information. Really presented it very clearly. I was able to follow everything that you were saying, and it made a lot of sense. So thank you for teeing this up. My name again is Carrie McAndrews, and I am a real sort of fan of arterial roads. I think they're very exciting places and challenging places. And to further introduce myself, this is the image of an arterial that I selected to share with you. It's an image of San Pablo Avenue. And this might be in Berkeley, it might be in Oakland, probably from around 2006. And this image includes several elements in it that come together to make that create a fascinating but challenging place. So in the foreground, we see a pedestrian signal button. We see also quite a bit of, I don't know, these blocky objects on the sidewalk, right? These could be barriers, these might be newspaper stands. A lot of communities have cleared this sort of thing, but it speaks to me of, well, what is it like to be a pedestrian on the sidewalk? What does that place feel like? I see street trees also in the foreground. I also see some signage. There's an individual waiting for transit there. There's a rapid transit sign that is kind of an expansion of the bus line that was there. It's kind of a BRT light where the transit agency created a limited stop system. But tucked right behind that is a sign that says California Route 123. And that is important because a lot of times these arterials have kind of complicated governance. They may be state routes that pass through local communities, and there's some limitations to the kind of decisions that can be made or interventions that can be carried out there. The sign tucked right behind that is the sign for a liquor store, which is a pretty common land use on arterials. But you see that it's right in front of a building that has some interesting architectural detail. This might be housing. This to me says that arterials are places where people live. They may be places with architectural value and heritage. Moving over to the left of the image, we see a delivery truck. This could be, this speaks also to arterials being places for goods movement. So we really have to think carefully about how is that curb space used? How are we managing parking? And I'll stop there, but as you can see, we can go on and think about what are the layers of activities that we see happening on arterials, and really says to me, many people have an interest in them. They have a stake in them. So let me figure out again how to share my screen. Yes, I see the button. Thank you very much. I can show my screen. And not only can I show my screen, I will maximize my slides so that everybody sees them. Okay, so now that I've covered my interesting and exciting San Pablo, I'll say that my role in this talk is to sort of focus on the health impacts and equity questions around arterial roads. And really in this next 10 or 15 minutes, I want to highlight the significance of arterials as places that even with high traffic volumes and relatively high traffic speeds, arterials can be places that are indeed health promoting. And this is why I selected this image of La Peña Cultural Center on Shattuck Avenue. This is also in Berkeley, because it signifies to me that there are nodes or locations that contribute to a place's identity. Often these are on arterials, and they really are places of social significance and cultural significance and economic significance for neighbors and entire regions. Let me navigate down. I need to ask my screen to do that. Thank you very much. So in this talk, my main argument, as I just said, is that arterials are places, but they're really these high impact locations where we can address kind of simultaneously health, safety, and equity. And that's because arterials are these concentrations of lots of activities, but lots of positive and negative health exposures, including safety, but not limited to safety. And I'll also highlight sort of two takes on this question. And one of them, it really revolves around questions of mobility, and the other one revolves around questions of place that may sometimes be in conflict with each other, but not 100% of the time. And at the end of the talk, I'll share two resources from TRB and NCHRP specifically about sort of health and arterials and about working with health in transportation. So I'd also like to mention, before I get down to business, a couple of premises that I keep in mind when I do work on arterials, and I share them with you to kind of tell you where I'm coming from. I want to acknowledge the diversity of arterials across the urban and rural continuum. They're really, they range from sometimes 2,000 vehicles a day to 60,000 vehicles a day. Their speeds can be slow or they can be really fast. They can be in rural, exurban, suburban, or very urban places. And really that context will matter when we're working on them. So in many cases, one size does not fit all, but we can leverage that context to really make a difference, to inform our questions and inform our answers to those questions. Arterials attract, by definition, multimodal trips, right? The idea that they can be for through traffic, regional traffic alone, does not really hold up to scrutiny. Something so interesting about arterials, though, is that they're complex and challenging nearly everywhere they're located, which tells me that if we can do good things to improve health, safety, and equity in arterials, we will have significant reach with those activities. And this tells me that we have a high impact opportunity to have a positive influence on health and activity by locating our activities and by thinking about health and equity in arterials. So, they're redesigned fairly often, they're reconfigured. Maybe we kind of turn our attention away from, bringing down highways and instead think about these everyday places that people use. So let me turn first to this question about mobility. I'll speak a bit about the research and practice and of what we know about how we can kind of use our interventions centered on motorized traffic to make kind of gains in these other areas. And I'll start with this idea about what the extensive health literature tells us on exposure to air pollution from vehicles. So in this area of the literature, there is actually sort of work specifically about arterials or high traffic roads, not necessarily freeways, but really these things that we're talking about. And the literature does tell us that exposure to this air pollution from arterials leads to health outcomes, adverse health outcomes, like cancers and respiratory disease and cardiovascular disease and poor birth outcomes. So not just on freeways, but also these sort of fresh or near roadway emissions on our arterials. So these are important disease outcomes and chronic illnesses in the United States and elsewhere in other regions of the world, where if we want to improve these and reduce health disparities in these ways, we would want to address them. And we can do that by looking at arterials. The research, in fact, sometimes doesn't measure the air pollution directly. It uses traffic density as a proxy for this. And those studies will say things like, mothers who are exposed to higher traffic densities have higher odds of poor birth outcomes, and that those odds increase with exposure to even higher densities, right? And so that's sort of how that logic works. And some of the ways that this affects populations is that our smart growth policies, often, sort of infill housing and multifamily housing that is located on these corridors through corridor plans and so forth, may exacerbate exposure to air pollution and some of these other outcomes. And we know from other studies that between 4 and 19% of the US population, depending on how you define things, lives close to a high traffic road, and that neighbors of high traffic roads like arterials are more likely to be lower income and minoritized groups. So this is a really important thing that people who are working in public health would want to be aware of, that it's not just sort of transportation in general that where we want to sort of seek partnership and create progress, but we really want to focus in on certain infrastructure. Now you might say, but as we move forward in our technology and innovation, we may see cleaner fuels in vehicles, and that this will really help us kind of solve this air quality problem, this air pollution problem. And now that's true, and this is not just an excuse for me to use this cartoon, which I love. The only emission of the teapot is water vapor. But indeed, there's also research from public health. They've been, focusing to some extent on arterials that says we also need to be concerned about noise. Again, obviously, injury and injury prevention, as well as community barriers, the way that disconnected neighborhoods and places with high traffic can be sort of negative social places. And so, indeed, even if we have clean fuels and vehicles, we really want to be aware of basically how we might want to manage traffic to improve these safety outcomes, sure. But in that management, can we also think about some of these other ways that traffic can have a negative impact on life, while at the same time thinking about, well, how can it have a positive impact on our lives as well, because we know we want these streets to be places of social activity and cultural activity. This is a logic model on the screen, and I know it looks quite complicated, and it really truly is. But when public health analyzes these issues on high traffic roads, they really do see as sort of individual contributing factors, traffic volume, traffic speed, traffic mix, as sort of upstream determinants that will influence things like health behaviors, healthy physical activity, and ultimately things like chronic disease. And this raises the question of how can we use the sort of even more traditional tools of traffic operations, geometric design, to think about physical activity, chronic disease, as well as something like injury prevention. How can we use traffic engineering essentially to improve health outcomes and reduce health disparities? And it's a complex diagram, but what happens is research sort of takes any one of these single arrows and investigates it to establish those connections. And this image comes from a health impact assessment, or a couple of them. It's a kind of a compilation. And there is in fact research and evidence that establishes relationships at each of those marks. It might not always travel all the way through, and research still needs to understand some of these more complex relationships, but this is to say, when working in public health, when I see arterials, I see that the way we work with traffic volume, speeds, and infrastructure will make a difference in these health behaviors and health outcomes. So that's really the challenge, and something interesting here. I want to tie this back to pedestrian safety. You know, communities already use traffic operations, intelligent transportation systems, geometric design to reduce vehicle emissions in these major corridors. These are fantastic tools that we should understand better, understand the potential health benefits of their application. Integrated corridor management is an example of this. There's a new NCHRP report out about doing that. Access management is really, the story about how do we manage, when our land use patterns demand a lot of capacity in our arterials, how do we manage driveways? How do we manage conflicts and turning movements to make these places where we can really get that capacity? Eco driving, eco routing, parking management are all tools that we know will affect how our traffic operates in these places, and can we use that management of traffic to affect things like noise, safety, pollution, etc. But here's the conflict though. We know from this research, so the body of work on these topics, that speeds that minimize emissions, especially in sort of heavy stop and go traffic, are around 45 miles an hour. And that is still too high to realistically survive a pedestrian crash. Like, that's just too high. So this is an example of how there are these conflicting goals, even within a sort of a health lens on transportation, where we can use some of these traffic management tools, to do some traffic calming in quotation marks, even though speeds are still high. But we need to really figure out how we can kind of make decisions or make these priorities in a forum, in a public forum, to say, well, what is an appropriate speed? How are we going to, if we have to have high speeds, how are we going to manage pedestrian exposure? We have to then have the right of way to create enough separation to make that a safer place, right? So this calls for that need, as Dan was talking about, for innovative practice. A health impact assessment can be very useful, a very useful tool for this as well, to sort of untangle some of these relationships, but also potential conflicts. So I want to highlight now a second topic, and this is another sort of area where I see a lot of potential for high impact research and practice. this idea of a livable arterial. And, one of the interesting things about arterials is that, if our networks were designed a little bit differently, we might not need to have 60,000 vehicles on this single roadway. Maybe we could distribute it into 25,000 vehicles on several roadways. But in the research that I've done with colleagues like Wes Marshall and others, we really have been thinking, what makes it possible to live successfully on an arterial? And through this work, we've learned that high traffic roads, those with about 25,000, maybe even up to 30,000 vehicles a day, can really be livable places. And this is work that we did in the context of, Denver, Colorado, primarily, but I've also done this work here in Madison, Wisconsin, and other places in the U.S., also in Mexico. So these are, relevant in regions throughout the world. But we learned that, especially in that study of Denver, that people valued the arterials close to their homes, and that these arterials did in fact support relatively safe multimodal access by implementing some of these known strategies. In fact, neighbors said, I like my arterial because it gives me so much mobility. Now, at the same time, those arterials had several amenities on them, as well as protective measures. So those amenities included street trees. They were, in fact, in the context of successful commercial nodes. Sometimes they did have some vacancies, true, and that was a problem. But what this tells me is that if we were able to redistribute some of the higher traffic, we could still maintain sort of that need for regional mobility. You're not going to get rid of all of the need for traffic at sort of this moderate level. Meanwhile, though, through this work, we learned that these high traffic neighborhoods do need even more stewardship and maintenance than what they are receiving. Neighbors do not appreciate it, and they do not like their arterials if the trash is not picked up, if there are vacant storefronts, if there are sort of illicit activities happening. Not that you want to necessarily go too far down the road with things like broken windows policing. That's not what I'm saying at all. But we do want to be mindful of and invest in municipal systems that help us maintain these roadways. So from a health perspective, we also know that research supports this, that two things. First is that the pedestrian safety isn't just limited to injury prevention. There's the element of perception of safety, which is absolutely not the same thing as absolute numbers and prevention of the injury itself, but it's a very important thing for the traveler. And it is important also for public health, because we know that safety, personal security, having basic services and pride of place in your community reduce chronic stress and make it possible for people to go out and get that health promoting physical activity, as well as other things, right? And that issues like litter and graffiti and drug use and alcohol and prostitution are negative, right? And they cause stigma, and stigma causes chronic stress, which causes other poor health outcomes. Right, these incivilities have been linked to those outcomes, and those incivilities are going to be happening here on arterial roads. These are images from an arterial road here in Madison, where the neighbors themselves took these pictures to say, these are the things that I find problematic, right? And this is a real equity issue, especially for women, gender minorities, and minoritized groups who we know are often targets of something like harassment or potentially violence on streets. But also who are likely to be neighbors of these streets. So this is sort of another factor that complements something like straight up pedestrian safety, something to be aware of. Two resources. The first one is, there was a TRB task force looking at arterials and public health, and it published an e-circular number 239. It's a multidisciplinary document, included people from different type of professional orientations within transportation and public health, raises a lot of research questions, but so exciting because it focuses on these cases. Each chapter has its own sort of focus: metrics, vision zero, proximity to arterials, retrofitting them, questions of land use, questions of technology, as well as models. This is a cool resource and one that's specifically focused again on arterials. It includes pedestrian safety as well as other topics. And then here's the other resource I wanted to share. This is a communication guidebook that was prepared under an NCHRP. Ann Steedley and that group led this. It includes sort of how are we going to collaborate across the different sectors? What are the known sort of practices, people at the table, ways to work with stakeholders across transportation and public health? And this is a NCHRP, and it's on at this link that you can find. Okay, closing thoughts to sum up. Arterials are really important places where our interventions can make a really important difference to improve health and reduce health disparities, mainly by dealing with these direct exposures that people have. Dealing with injury, potential, right, we want to mitigate and reduce causes of cancer, poor birth outcomes, respiratory disease, cardiovascular disease, and chronic stress. These are the major health outcomes and behaviors that are linked to arterial roads through research. There's also research that says the social aspects of arterials also cause chronic stress and diminished physical activity, and those are caused by things like lack of connectivity, community severance, litter, graffiti, harassment, and areas that are perceived as being insecure. So we can do something about that too by investing in things like maintenance, by investing in activities that bring pride to place and expressions of care. We also know that between 4 and 19% of the population lives close to high traffic roads, depending on how they're measured. That's why there's such a big range. And that these neighbors are disproportionately people of color and lower income residents, right? So there's this, by virtue of proximity, there's true exposure. And these are reasons why we want to take on an agenda for health, safety, and equity in arterials, to acknowledge the trade-offs. We want to manage traffic and networks with health, safety, and equity trade-offs in mind. We know that livability on arterials is possible. They are multimodal places. They are neighborhood resources that can, in fact, host amenities that make them more livable, at least up to a point. We want to reduce litter and physical decay. We want to support pride in place and stewardship on our arterials. This helps us balance the mobility function of that road as well as their place function. And then finally, we need to disaggregate our data. We know that you're out there collecting data by gender and race, ethnicity, and income. Analyze those data and look at these outcomes by group to understand, if there were a difference between groups, what would you do about it? If everybody's the same, does that matter for how you plan and execute these ideas on arterials? This is a researchable, an empirical, and a solvable problem. We have the tools to do it, and we can make it happen. And this is a wonderful opportunity to make a difference through arterials. Okay, that's my spiel. Thank you for listening. This is my contact information, and these are the references from this talk. And now I am going to focus my attention on turning this back over to Thomas, who is our next speaker.
Thanks, Carrie. So we'll get the slides going. While we do that, by way of further introduction, my name is Thomas Hillman, and pedestrian safety on arterial streets is a big part of what initially got me excited about transportation planning. Whoops, I think we're still working on the slides. So I'll just hold for a quick second while we get that sorted. Yeah, that's perfect. And yeah, we just need to switch the display settings, yeah. When I was in graduate school, a driver crashed with 3 elementary school students crossing the street right in front of their school. This was at a marked crosswalk across the same arterial street where our university building was located, less than half a mile away. The kids were rushed to the hospital in urgent condition. And notably, a road diet study was completed for that same corridor in the months before the crash, but implementation had not yet begun. So this is 14th Street in Northwest in Washington, D.C. I walk and bike along the street every day while completing errands, visiting friends or restaurants, traveling to play soccer, or commuting to and from public transit stops. So a few fun facts about this street. As you can see in the photo, there was a quick build road diet project that was completed in 2020, which converted one travel lane in each direction to bus and bike only lanes. This used exclusively low-cost materials, so essentially paint, the flex posts that you can see and those parking stops. It also has a barn stance pedestrian crossing signal at the metro station. That's where the buses are parked. It also has high density commercial and residential land use, along the whole corridor. So these safety improvements resulted in a design that is not perfect for any mode. It's a constrained right-of-way with high motor vehicle volumes, multiple high-frequency bus routes, and high bicycle and pedestrian volumes. But the new cross-section is functioning much better than the previous as a multimodal street. And anecdotally, it's resulted in major safety improvements for pedestrians by encouraging contextually appropriate vehicle through and turn speeds. And because the design used quick build materials, it resulted in immediate safety gains that can be tweaked over time to perform more optimally before a long-term project is constructed with permanent materials. So for example, crossing islands could be constructed at the intersections in the long-term design to improve safety for crossing pedestrians of all ages and abilities. So with this example in mind, let's dive in to discuss the systemic safety approach and design treatment options for arterial roads. So we've heard a lot of great information about the complex history and modern day operational challenges on arterials. So how can we make arterial roadways safer and more comfortable for pedestrians while facilitating smooth travel for all modes? Let's take a look at the current state of practice for planning and designing safer and more equitable arterial streets. So, planning arterial roads to be safer for pedestrians can start with a safe system approach. FHWA endorses this holistic way to identify safety issues and redesign high-risk roads, such as arterials, throughout the system to reach the goal of 0 deaths. A safe system mindset anticipates human error and accommodates human injury tolerance. Therefore, a key aspect of building a safe road system is creating transportation infrastructure designed for safer speeds and harmonious use by everyone who needs to use the road, including people driving, people operating transit vehicles, people walking, and people biking or riding scooters. Roads designed with a safe system approach use engineering measures that encourage safer travel speeds appropriate to the adjacent land use context and the predictable mix of road users that the context will attract. And implementing multiple layers of safety infrastructure at a given location is often key to influence user behavior, alter crash dynamics, and create substantial improvements in safety. So for example, a single intersection may have multiple pedestrian safety treatments such as signal timing changes and changes to the turn radius or crossing geometry. Next slide, please. So, systemic pedestrian safety infrastructure, this approach, there are sort of two key takeaways to bear in mind. One is that a systemic approach identifies many locations for rapid safety measure application. So this differs a little bit from a more traditional hotspot approach where, you see where a crash occurred in the past and try to treat that location. The systemic approach looks at essentially all the locations with similarly high pedestrian safety risk. And seeks to treat as many of those locations as quickly as possible. And it also focuses attention and resources on averting severe and fatal crashes, at least initially, to really address the greatest risk for pedestrians. Next slide, please. So there are a lot of planning and design considerations to bear in mind when considering making safety improvements to arterial roads. Probably first and foremost is the adjacent land use, right? So, are there commercial, buildings or, parks, other attractors or generators of pedestrian activity? Also, the context of the road itself, right? In the existing conditions, what are the motor vehicle volumes, speeds, turning movements? Transit is another big one. So, are there existing transit routes along the road, and what are those operational requirements? But yeah, a lot of things to bear in mind as when one starts to consider the different treatment options for an arterial. Next slide, please. So, one question that's often asked is, there's a whole bunch of different treatments, that are available to improve pedestrian safety on arterials, and we'll get into some examples of those in a moment. But, how do we know which of these are effective? So, there's research that supports evidence of crash reduction by implementing, these roadway safety treatments. That specifically, estimated the crash modification factor. You might hear that term CMF or crash reduction factor, CRF. But it's important to bear in mind that crash reduction estimates don't exist yet for all treatments, but that there is a good body of related research and a lot of precedent from existing use of some of the more innovative treatments that can indicate the safety benefits. Next slide, please. So, in terms of considering options for implementing safety treatments on arterials, there's really kind of a spectrum. So, there's lower cost, rapid implementation treatments. Those are ones that would typically be considered, following a systemic safety analysis and using a systemic safety approach, to get that rapid implementation at many locations across the network. Perhaps a more traditional approach is sort of the corridor reconstruction, where you define, a corridor length, for an arterial and, do it more intensive engineering and design work, and then construction work to more fundamentally, change the way that the corridor is designed. This could include, moving or planting trees, changing the drainage, moving the curb line. Generally it's higher cost and longer time frame, and so it is therefore more difficult, for jurisdictions to complete. And these projects are more intensive in terms of the resources, and energy required. And then there's, network redesign, which is an even more sort of fundamental, like higher level zooming out, considering, how is the network functioning, in a given place, in a given city, jurisdiction, and considering, sort of how each road works together as a network, and sort of what opportunities there may be to potentially realign how roads are intersecting with one another, or functioning as a network. But it's important to sort of note that all of these approaches can have substantial benefits for pedestrian safety, and that they're not mutually exclusive, but rather that they're kind of a continuum. Next slide, please. Yeah, so in terms of the key implementation solutions to consider, of course, those interim safety improvements through rapid implementation are quick, they're less costly, they're designed to save lives, and they can they can help to refine capital projects that eventually are implemented along the same corridors based on real world use and operations. Again, the improvements to the road network at locations most likely to result in a fatality or serious injury are the most important. Certainly coordination is key, right? There's a lot of stakeholders that need to be involved, on arterial roads. They're complex road environments, and of course, leadership is a really important aspect of the equation. Next slide, please. So, let's talk a little bit more in detail about the types of crashes that we're trying to avoid. So pedestrian crashes can be summarized using the movement of the striking vehicle, whether it's turning left, turning right, or going straight. And these different types of crashes can be addressed with different treatments. So some treatments are applicable to more than one crash type, and that's good to bear in mind. So there are many, different pedestrian safety treatments that are available to address each crash type. We'll walk through just a few of the common, safety treatments before discussing the benefits and application guidance more broadly, and reviewing a couple of the more transformative safety treatments that are available to improve pedestrian safety on arterials. So the first one is those left turn pedestrian safety treatments. So some potential low-cost systemic treatments for left turn pedestrian crashes include hardened center lines and turn wedges to calm left turns by channelizing and slowing left turning vehicles. And this is not pictured, but left turn restrictions are also, a good example of a low cost safety treatment that can be applied to improve pedestrian safety throughout the system by eliminating the source of intersection conflicts in strategic locations. So in terms of right turn, pedestrian safety treatments, this is often also referred to as a right hook when a right turning motorist strikes a pedestrian. And some examples of low-cost systemic safety countermeasures include leading pedestrian intervals, or LPIs, and corner radius reductions. In terms of crashes with motor vehicles going straight, there are many countermeasure options available to reduce this crash type. Certainly at signalized intersections, which are very common on arterials. Low-cost systemic safety treatments include the addition of crossing islands or signal timing modification. At mid-block locations along arterials, the addition of raised crossing islands can reduce the crossing distance and provide a refuge for pedestrians between opposite directions of motor vehicle and travel lanes. And other common pedestrian mid-block safety treatments include rectangular rapid flashing beacons and pedestrian hybrid beacons. As I mentioned, there are a whole lot of different countermeasure options that are available. These are just some of the key ones that are often considered and implemented. They're not all systemic safety treatments, right? So installing a pedestrian hybrid beacon is typically a little bit higher cost and more complicated than say adding a temporary curb extension with some paint and flex posts. So there's a spectrum of cost and complexity when considering which treatments to apply, but there are a whole lot of different options out there and available. Next slide. So this is a slightly more comprehensive list of those pedestrian safety treatments and their benefits. Really, the key takeaway from this slide is that for every treatment shown, it's expected to help accrue more than one type of pedestrian safety benefit, right? So might result in lower speeds or safer crossings, increasing visibility between pedestrians and drivers, etc. So a really good resource to consider when thinking about countermeasures for pedestrian safety on arterials is the Federal Highway Administration's Safe Transportation for Every Pedestrian, or STEP program. They've developed multiple resources to guide the selection and implementation of pedestrian safety treatments, including on arterial roads. And the STEP Studio resource is a new guidebook that includes detailed and approachable guidance on steps in the pedestrian safety treatment implementation process. So that a few of the topics that it covers are listed there on the slide. And so yeah, just some quick info on a couple of more sort of transformative treatments from a pedestrian safety standpoint on arterials. Road diets have multiple pedestrian safety benefits. They shorten crossing distances and reduce motor vehicle through and turn speeds. So just backing up a half step, in case there's anybody on the line who is not yet familiar with road diets, that's when one or more motor vehicle through lanes is repurposed, and so the total number of through lanes is reduced. And implementing a road diet therefore frees up space in the right-of-way for critical pedestrian safety infrastructure, things like crossing islands, curb extensions, and sidewalks with physical buffers between motor vehicle travel lanes and the sidewalk edge. And another example of a treatment that can really have a big impact, where it's implemented, is protected intersections. So these use floating curbs to provide better physical separation between modes and channelize motor vehicle through and turn movements. This results in smoother, slower operation compared to conventional intersection designs. And the treatment typically results in multiple safety benefits for pedestrians and other road users. And protected intersections are being implemented in jurisdictions throughout the United States. So, you know, in terms of resources, there's a whole lot of good information out there, you know, to help guide folks as you know, they're considering the different countermeasures that are available, and you know, evaluating trade-offs, you know, from a planning and design standpoint. You know, there's the CMF clearinghouse, which you know, has information on those expected you know, safety benefits of different countermeasures. There's PedSafe, you know, which has a pretty comprehensive list of countermeasures as well. There's, you know, the STEP guide and the STEP studio resource that we had you know, previously mentioned, and you know, obviously you know, planning and design resources like the AASHTO Green Book, you know, the NACTA or District Design Guide, the FHWA Achieving Multimodal Networks guide, which helps to kind of you know, think through some of those trade-offs that are particularly salient on arterial streets. And you know, so just some of the you know, top key resources from that list, right? There's good information as well from USDOT on equity, and FHWA on the zero deaths goal and safe systems approach, and a variety of other key resources. One that I didn't highlight yet that's very good as well is the NCHRP Research Report 926. That's guidance to improve pedestrian and bicycle safety at intersections. And with that, I'll pass it back to Dan and open up the Q&A.
All right. Thanks very much, Thomas. I appreciate it. I think we're going to sit Dan Goodman on this slide for a bit while we handle some questions. A lot of great questions. Thank you all so much for sending those in. We're going to get through as many as we can in the time that we have. I've tried to. There were lots of questions on similar topics. I'm going to try to do my best to push some of these together. One of them, several of them, are all on the topic of road diets. A lot of interest in road diets, lane conversions, and how we can kind of better, for lack of a better word, to kind of rebalance some of these arterial streets to make them more manageable and serve users in a better way instead of mainly catering to traffic, motor vehicle traffic, that is. So there were some comments on these sort of 25,000 ADT corridors sort of being ripe for road diets. Somebody was specifically asking about 5-lane to 3-lane conversions, but there's still resistance to doing those, and still what we're doing with some of our arterials is acquiring right of way to expand them, maybe in the expansion of them, adding things like bike lanes and sidewalks, but still increasing the number of lanes rather than just getting down to maybe a more manageable size. So well, the question that a lot of people had is best ways to go about, what are the best ways to go about kind of getting transportation agencies, decision makers on board with pursuing these 5-lane to 3-lane road diet conversions, especially in that 25,000 ADT range where they're manageable and they can be done. And I don't know, Dan or Thomas, if you want to start with that, and Carrie, maybe you have some thoughts as well.
Yeah, I'd be happy to maybe to begin the answer. I think an important point here when we're having this discussion, rather than jumping right into the number that would hypothetically be okay, and since we're not at that number, then folks are unwilling to accept it. I think it's really important to take a step back and think about kind of what is the outcome that we're trying to accomplish. What are our values in the community based on what we've said in our transportation planning documents, and how are we making decisions? And so I think a big piece of advice that I would have is that it's not all about the traffic analysis and the travel time analysis. That our community goals are much broader than that, and that's one of the considerations that we need to be thinking about when considering a road diet, but it's not the only one. And so I think that's fully consistent with how we do transportation planning in the US, which is looking at a broad range of performance metrics that can include safety and accessibility for people with disabilities, pedestrian and bike quality of service metrics, traffic analysis, travel time. But it needs to be the combination of all those things. And so I think in a planning process, if it ever comes down to a number and we can't do it because of that number, to me, what that says is that we need to back up and talk about our values and the outcomes and what we are trying to accomplish in our community.
That's a great point, Dan. Thomas, any additional thoughts on that, or maybe Carrie? I don't know if you've thought about these road diets and maybe the argument or the ways that they can be maybe more attractive options for those who may not be as comfortable or want to instead expand roadways rather than trim the lanes down.
Yeah, that's what Dan says rings true to me as well. And I don't have anything very significant to add to it. I suppose I have heard that looking at case studies of how things have been implemented in comparable places can be a useful way of taking the edge off.
Great. Yeah, thank you for
Yeah,
that.
I think that's all spot on. I guess the one thing that I would add is, a good community involvement and engagement, right? Doing the work to get folks involved and bringing them on board, for those types of changes.
That's great. Thomas, I'll stick with you for a moment because we got a few questions that came in at the tail end of your presentation, some clarifying and then one to kind of build on. There was some confusion or unfamiliarity with the term floating curb or floating island. You used that term floating a few times. I wondered if you could clarify that for those in the audience who may not be familiar.
Yeah, sure. In essence, at a protected intersection, there's a bicycle travel lane typically, between the sidewalk and the motor vehicle travel lane. So that's where those curbs would be placed at the corners of the intersection. And the result of that is it provides a few safety benefits. Certainly for bicyclists, it helps to separate them from motor vehicles at the intersection, and sort of clarify the conflict points that Dan was talking about at the beginning of the presentation, by sort of focusing those into a single location as opposed to a really wide stretch throughout the entire intersection. And yeah, for pedestrians as they cross, they start at the sidewalk, they would cross the bicycle lane, and then they would have a refuge at that floating island between the bike lane and the other side of the street where they would cross the motor vehicle travel lanes. So it results in a shorter overall crossing distance because those floating islands are located closer to one another at the intersection than the curb line would be, where you'd have your drainage and the buffer between the sidewalk and the roadway.
Great, thank you for clarifying that point. Dan Goodman, maybe I'll start with you on this next question. When Thomas was sharing information about kind of the shift toward a systemic approach, think about on our arterials generally, we're talking about solving a problem that extends maybe a half mile, maybe 2 to 3 miles. They're long corridors, yet we still have some agencies that I think are primarily focused on drilling down to the hotspot locations, in quotes, the places where the crashes or the fatalities have happened, and kind of making changes there rather than kind of thinking corridor wide. And I think the corridor wide vision is more of the systemic. We're looking broadly at what the risks are along the whole corridor. This is similar to the first question about road diets, but what are the key ingredients for an agency to begin that shift from the focus on the hotspot to broadening their perspective and looking more broadly at the risk factors that may lead them to fixing an entire corridor segment rather than just one spot?
Yeah, I mean, I guess first I would say I applaud them for the effort, because they, not everybody is doing that. So I think it's better than nothing to pursue a hotspot approach to making safety improvements. What I would caution against is getting into a situation where you're constantly crashing, you're constantly chasing the last crash that happened, rather than understanding from a systemic perspective the conditions that made it more likely for the crash to happen at that location. And as Thomas described, going and fixing all of the places that have that same condition occurring. Because, I guess what I would say is that we've gotten incredibly sophisticated in crash analysis. I think there's a lot of jurisdictions and cities, places like Seattle and Austin, Texas, and elsewhere that have gotten very, very sophisticated. And I think we can learn a great deal from them. I mean, I think ultimately we need to be looking at the results, and we need to be finding the agencies and the jurisdictions that are having success in actually ratcheting down their number and replicating what they're doing, not getting too caught up in how we used to do it or how we think it should be done, and more measuring our success and providing direction based on what we actually know works based on real evidence. So I think, that would be my advice, is that we're getting better and better and better at crash analysis, and we need to take advantage of those advances rather than being stuck in the past and how we used to do things.
No, that's a good point. It's a good challenge, I guess, too, for some of us. Carrie, I have a question that I'd like to start with you, and then maybe we can broaden out for the other panelists if they have responses too. Getting to some of this discussion of crash problems along arterials, one person was asking about, have we looked at the difference between on some of these arterial streets that kind of share these characteristics, the crashes and the injuries and deaths that stem from the crossing of the arterial by pedestrians, rather, or as opposed to the maybe crashes that may occur with driveway conflicts, the turns that maybe people coming on and off of the arterials, the frequent entrances to maybe shopping centers, and have we been able to drill down and isolate the most prevalent problem, and this person is, I guess, getting at maybe these two things could be happening, but is the bigger focus on one or the other when we really think about what we need to do to make our arterials safer for pedestrians?
Yeah, that's an important point, and I don't have a perfectly direct answer to the question, but it does raise a couple of issues in my mind. And the first is that on some of these arterials, managing traffic and thinking about its design is going to be constrained by the fact that it might have intersecting or crossing arterials that also have high traffic volume. So you can't necessarily, do everything you want to, with like signal timing, for example, on this, like, let's say you've got the through arterial. So yeah, that network thinking is really important, but specifically on crashes, I don't know the answer to that. I would imagine that it's both, and that both need to be kept in mind. But then the issue of driveways raises the prompts in my mind the question of access management, and upon looking at, like the sort of health perspective, like what do our different fields say about arterials? Well, there is something of a bandwagon with certain approaches to design. Like, these are like design paradigms. Access management and complete streets, for example, look like they're two opposing frameworks, but neither one of them is really, I don't think, like, they all sort of make claims about their ability to deliver safety outcomes, but I'm not sure they've really ever been compared. And I think there's a real need to sort of put all of these features, to think them through more methodically, to imagine, well, we want to manage driveways and we want to manage motorized traffic, but at the same time, we also want places where pedestrians and cyclists and access to transit are going to be really effective. And I would like to not see those things always in opposition, but to imagine ways of synthesizing them. And I don't think that work has yet been done. Maybe it has, so please let me know. That would be very cool to follow up with.
I think maybe, Carrie, just if I could add on that, I agree with that. I think the important point to remember is that none of the approaches, likely are not going to, they're not going to eliminate all conflicts. People are going to make bad choices. It's going to happen as part of natural human behavior. But I think a really important part of the puzzle is to reduce the speed so that when the conflict does happen, it's less likely to be fatal. And I think that maybe is something that can go across the different paradigms, kind of the general design principles that I think could potentially be consistent across different approaches.
Yeah, I think that's exactly right. And sort of, building on that information and tying it back to the original question, in terms of, do we think that, driveways or intersections are more problematic from a pedestrian safety standpoint on a typical arterial road, existing condition? I would echo Carrie's, caution that I think it does depend a lot on the corridor and the specific conditions in question. But to Dan's point, sort of more broadly, a lot of what contributes to serious injury or fatal crash risk is that speed part of the equation. And so I would venture that typically a driveway entrance is probably going to be at least somewhat lower speed than an intersection in terms of the design speed of the existing conditions. Although I think the speeds, the expected speeds of folks entering and exiting each of those locations would be a potential indicator of where safety risk exists.
I want to build on that point, Thomas, and keep it there with speed and fold in some other risk factors, because there was a really interesting question about during COVID, we've seen some stories about the excess of speeding, the problem of speeding kind of going up a bit during COVID. And the person I observed that we'd always assumed that a lot of nighttime fatalities may be an issue of lighting, and to add lighting is a good thing to do, and definitely is to keep those down. But they wonder about the degree to which, or the role that this excess capacity on roads, when traffic volumes go down and there's much more space on roads, even at night, what role that excess capacity has on those speeds, those operating speeds that may entice drivers to go faster. And I'd never really considered that point before. It certainly seems like an intersection of risk factors when you think about both dark conditions and speed. But just this whole point of these roads are built to capacity to maybe manage, the peak periods, but then in between those, we may have a lot of excess space, and it may feel more comfortable to speed. I wonder if you all have any thoughts about that.
Yeah, I mean, I think that is an issue in a lot of places where you've got a lot of excess pavement, that, you've got continuous center turn lanes that don't really have anywhere to turn into. They're just there. You've got wider lanes that we do have research that shows kind of those lot wider lanes can contribute to faster speeds, extra lanes, and just generally oftentimes unnecessary pavement through wide turning radii and slip lanes. So I think there's a lot of opportunity to tighten that up without necessarily having a big impact on traffic. I think the lighting question is really interesting. I think it's what we've been saying all along, that these are dynamic and evolving places. And so, as Carrie has mentioned, it's very difficult to pinpoint one thing because there's a lot of overlapping factors. I think a lot of it comes down to speed. When it comes to lighting, I guess a question I have is if in the pandemic, there was a question in the chat box about crashes increasing in places where there was lighting more, which I think is really interesting. My immediate question is, are we able to tell the places that have lighting with bulbs that are functional? Because I think we know in our system maintenance is a continuous ongoing problem. And so I would like to know if the data show that there is lighting, if kind of the extent to which we can see if it's functional lighting or not.
And those are good questions. I think that's it's certainly a challenging area that lighting being one that it sounds like from the comments when we asked everyone to describe their arterials and some problems early on, a lot of mentions of lighting, low lighting and just dark conditions that if there was lighting, it seemed more intense for vehicle traffic, motor vehicle traffic rather than the pedestrian scale. So that continues to be a challenge for many communities. Carrie, we had a question during your presentation. You were describing what could make a 25,000 vehicle per day arterial still be a livable place. I don't know if that's the word you used, but that's what this person asking the question took away, and that word livability. They're asking now, can you envision a scenario in which a 45 to 70,000 vehicle per day corridor could still maintain some level of livability, or in some of the work that you've done around that, the points you were making there, is it capped a bit? Is there a limit beyond which the traffic increasing is really not going to be livable for anyone?
Yeah, that's a really useful question. So in the study that we did, we had 10 arterials around with commercial nodes, and they ranged in traffic volumes from 2,000 to 60-ish a day. And what was so interesting about it was that some of these sort of arterials in the middle range, around 25 or 30, it's kind of performed better than those with, make only 10,000 vehicles a day, right? There was something about them that people really appreciated. They had a lot of active land uses. They were places where people could catch transit. They had bike lanes. Like, people valued them. The ones with the higher traffic volumes were more challenging, but they also sort of didn't have the other amenities. And they were really intensely trafficked. And their right-of-way may have been a limitation too. So getting directly to the 45 to 70,000 vehicles a day, here in Madison, there's a large arterial that carries about that up at the upper end of that. Then we also have, like a limited access freeway that carries about that much too. And so I'd say, I prefer the at-grade arterial to the limited access freeway in terms of like being a neighbor to it 100%. And even the ones with the higher range, they are more challenging if you don't have the right of way to put in the kind of separation that you would need to manage exposure, right? It's going to be rough. And then also on this conversation we've been having about excess capacity at off-peak times, run into a lot more of that with these roads that see those upper ends of traffic volumes. I'm not, I think you'd have to look at other regions that have these multi sort of wave boulevards. You'd kind of get into this really sophisticated, like very special design models to accommodate that. Could be hard to cross. I'm not sure I would advocate for it, but I think in special cases you could make a really interesting, you could give it a go. Yeah.
Yeah, no, thank you. That's really useful. I think it's it's like choosing between two bad things. It's 25,000 or maybe upwards of 70. But I think your point is well taken, that there are solutions there, and that it's not a throw up your hands and give up sort of thing. I think that there's opportunity. It sounds like that's a good takeaway for folks.
Could we distribute that? I mean, could you get away from these 60,000 arterials altogether and start to shake that down a little bit? And I mean, and not necessarily going through and telling everybody their road is going to change next week, but over 50 years, you could reconfigure our land uses and our roads to do that sort of thing.
Sure. No, absolutely. Thomas, we had a few questions. You shared a great kind of toolbox of possible solutions on arterials, and lots of folks reporting that they're struggling with conversations around lane widths on arterials, not necessarily eliminating lanes that we're talking about with road diets, but simply the narrowing of lanes, and maybe some that might facilitate slower speeds, maybe getting away from the 14 feet and the larger lanes and down to 10 to 12 in some cases, but getting pushback on things like emergency vehicles need these wide lanes, and there are all these other various reasons why these narrower lanes can't be done on arterial streets. And I wonder if you could shed some light on just lane width in general, what we know, and what might be good kind of current recommendations and current standards. And is there really a limit to what a lane width could be on an arterial street, maybe compared to some some collector or some other lower speed, lower volume residential streets?
Yeah, for sure. I can at least start to answer that question. So in terms of the speed question, I think that's really key, right? So if you're in, a more urban place where, a context appropriate target design speed is, 25 miles an hour for an arterial, because you expect to have, higher pedestrian and bicyclist volumes. You might have some more flexibility than, if you're working on an arterial in a more suburban or exurban, context where, the design speed is, say, 45 miles an hour. And you might have, more concern with, say a 10-foot, travel lane. I think certainly, in urbanized areas where you do have those lower design speeds, there's good research showing that there are safety benefits, multiple safety benefits to, reducing lane widths down to 10 feet. There's good guidance from, NACTO on the lane width question, and there's research to support it. I think, in terms of the question of, things like emergency vehicles and, delivery vehicles, right, commercial vehicles, I think 11 feet, tends to be the sort of general consensus. I know there are a lot of, good examples of jurisdictions that have implemented, these lane width reductions, right? So I think in New York City, as I understand it, the standard is 10 feet for travel lanes on arterial streets included, and for outside lanes where there's transit, 11 feet. And so I would say, yeah, maybe pointing to those precedents and the resources that are out there, to support the the lane widths. And then, with respect to emergency, vehicle operations, I think it's really important to engage with, the folks that are responsible for operating those vehicles. They're important stakeholders, in the community and in the design process. And I think, helping to sort of better understand what their concerns might be, specifically, and sort of take their perspective. Trying to get through a place quickly to help folks in emergencies can help to sort of get a better sense of what the specific sticking points are, and have that dialogue that can result in perhaps an outcome that's closer to what might be ideal from a sort of everyday engineering safety standpoint.
Thank you for that. I think that seems to be a big sticking point in many communities, but I think some of these examples you've shared could maybe help get those conversations going. Thomas, I know we wanted to save some time now. I think it's a good transition to maybe some final thoughts from our panelists on, maybe next steps for research or practice in this area related to arterials and safety. And I thought, maybe Dan Goodman, we could start with you if you've got some thoughts ready.
Sure, I'll go really quick. We've only got 2 minutes. So I think that one thing that is worth considering with arterials is that we traditionally think about them in terms of long linear segments. And I think the more we can think about nodes along the segment and proactively changing those nodes, ideally through multimodal infrastructure that also improves safety in the near term, can help to intuitively understand, help users intuitively understand a change in activity along a node, which can end up having a positive corridor-wide benefit. I think there's a lot of opportunity in exploring that. Carrie, did you want to add something there?
Yeah, that's excellent. A+. That was, 100% support the idea of the node. Really useful. But so the node is a way that we can deal with the conflict between creating place and having that high level of mobility. But that speaks to the bigger question, I think, of like needing to tackle and face and discuss trade-offs across our priorities and actually arrive at a community sort of approach to what they want this arterial to be. I think that arterials got to be the way they are because we've never really decided. We believe they can be everything. They can be mobility, they can be high access and high mobility, but what you get is a lot of conflict. So if we try a little harder to create a forum to have those conversations about those trade-offs, let's see if that helps us move one step forward.
Yeah, real quick, I would say, just if it's not clear, I think orienting oneself with respect to safety with a bias towards action and acting quickly is beneficial and really necessary given the scale of the challenges. Arterials are complex, locations, and they can be really daunting to consider, how can we reconfigure a road to have substantial improvements in safety? How can we make sure that we are providing for all the operational needs of the space. But quick build projects and materials are really great to do some initial analysis, experiment with how a solution can function before the longer term investment in a capital project.
Thank you all very much. I think there's some good challenges there for all of us moving forward. I hope that no matter where you're coming to this issue from, you found something useful in today's presentations and kind of something you can take and bring back to your communities and maybe start some of these tough conversations about solving these streets that can really represent some of the biggest problems for pedestrians in our communities. So I want to thank our panel again, Dan Goodman, Thomas Hillman, and Carrie McAndrews for spending time with us today and sharing. I appreciate everyone out there attending today and your questions, your comments along the way. We really appreciate it. We hope to see you on the next webinar. Stay tuned for information later today with information about the webinar archive, certificates of attendance, and all the other resources that we'll provide to you. And thank you again. We look forward to seeing you on our next webinar, everyone. Thank you.